Hi, my name is Jaylene Roman. I'm going to be presenting my final pocket guide for class NU 665B, Family Practice. I organized my final pocket guide as I did in the last semester. I just added more content. It's in a 3-ring binder with my table of contents and my sheet protectors. So in this binder, I have some last semester, but since I'm just going to be going over the new content today. So starting with neural. So with neural, I added understanding the nervous system, what each lobe stands for, what they do. For example, frontal lobe, emotions, memory, behavior, language. Occipital lobe, vision, processing, temporal, speech, hearing, the brainstem. And then I talk about um the the SCE fluid, the cerebrum spinal fluid, what it contains, what it is, if it's an emergency, and what's included in our exam, mental status, motor function, sensory, pupils, reflections. Yeah. I mentioned here the glaucoma scale. I'm so sorry, my throat. I've been having such a sore throat. And cough. What is it? I talk about, so then I go into brain infections and meningitis in kids, the positioning, the sign and symptoms, the Turner sign, the treatment. Then I talk about seizures, the treatments, medications, what it is, what to do. Then I go into ortho. I talk about knee. So I grabbed from the American Academy of Orthopedic Surgery. They had these great PDF forms that I grabbed from them. I felt like I liked their detailing. They talk about what like each ortho is and treatments and diagnosis and all that. So I grabbed a few. I did the knee osteoarthritis, and it talks about symptoms, diagnosing, treatment, type of treatments like lifestyle changes, medication, PT, rehab, surgery. And then I picked osteoporosis. And same thing with that, what it is, how you treat it, like why it happens, how can you prevent it, especially in a woman, getting enough vitamin D and all that. Then I talk about arthritis. Same thing. Hip arthritis, same thing. Pretty much each little like PDF form sheet just includes like what it is, how it happens, the treatment, diagnosis. Low back pain, continuous scoliosis in children, what it is, how it develops, surgery, carpal tunnel syndrome. And I like these because I like the pictures, but it comes with it and all that. So, and it's like right to the point. It's like quick. That's what I like about it. Then I talk about infertility and breast cancer. With infertility, I talked about what it is. There's two types, primary and secondary. factors that affect infertility, the basic infertility workup, the evaluation, the treatments. And then I talked about breast cancer, how I talk about the mammogram screening starting at 45. Then I talk about the different types of breast cancers, like there's invasion and non-invasion, the tumor stages, how they're staged. Talk about the treatments, surgery, chemo, radiation, therapy. Then I grabbed this from the the Susan G. Komen. I liked this breast cancer screening during the warning sign. I liked it again because it has pictures. And it talks about breast cancer screenings, follow-up tests and all that. Very informative. And then treatments, decisions. And then the one I grabbed from the U.S. Preventative Services. Same thing, BRCA, like with BRCA, BRCA2 for breast cancer. Then I go into menopause and osteoporosis. Talk about what is menopause, symptoms, hormonal changes, risk factors, treatments. And then I go into osteoporosis. But before I go into that, I grabbed this from the USPS menopause hormone therapy for the primary prevention of chronic conditions. And I talk about what is menopause hormone therapy and the recommendations and all that. So I like a lot of PDF sheets from different organizations. So going into osteoporosis, I talked about what it is, risk factors, screening, which is very important. There's two types of screening for osteoporosis: the National Osteoporosis Foundation or USPTF. And then I talked about the BMD, tests and results and treatments, which is there. Then we go into psych. So I talk about MDD, which is the major depression disorder. And I talk about how if it has to be 5 or more of these symptoms that I have listed for more than 2 weeks. Then I talk about suicide, how that's very important. I talk about some medications, SSRIs, the side effects, the warning dots for PD and young adults, suicide. I talk about, when I go into anxiety, I talk about if you have 3 or more of the following 6 symptoms. And then again, going into suicide, talk about the warning signs. And then I talk about the screening. There's different screening tools, like how there's the audit for the alcohol, the QAD7 for anxiety, the CAGE for just general, the DAST for drugs, PHQ-2 for depression. And then I talk about different psych medications there, what they are, what they do, side effects, warning boxes. Same thing, talk about different medications. Then we go into eating disorders. So I went into a website, it's called Eating Recovery Center. They had really great, like a little form for different eating disorders. So I grabbed anorexia, which each one includes symptoms, warning signs, health risks, treatments, when to seek help. Same thing for bulimia. And then I grabbed this, she talks about how bulimia affects your body. Then I talked about binge eating, same thing, what it is, treatments, symptoms, health risks. Then I included tuberculosis. I got this from the CDC, this sheet. Talked about what are the symptoms, what it is, how it spreads, what's the difference between latent and TB disease. How do you get tested? What should I do if I have been exposed to it? Then I go into HIV, same things from the CDC, how it's transmitted, how it's not, how do you protect yourself, how do you protect others. And then I just grabbed this gender unicorn from one of the slides that we had from the lecture. Very helpful. Then I go into advanced directives. I talk about the most form. I printed it out, just I wanted a copy of how it looks. Information, how to fill it out for the patient, for the provider. Talked about, and then I have a sheet about the healthcare proxy. Same thing, information on it, how it looks. And then for personal issue statement, I grabbed these from the Massachusetts.gov website. And that concludes my pocket guide. I really enjoy doing the pocket guides. I feel like it's going to be really helpful for me in the future as I provide care. It's right to the point. I like how I set it up with pictures and like I highlighted what was the most important. And honestly, it's a great little formula for the future. So I want to say thank you for your time and I hope you enjoyed my video. Bye.